Dr. Kateh, welcome to the program. Long time no see.
Thank you so much, Sorbor. It's so good to see you. I mean, looking so vibrant this
Oh,
morning.
surely,
And
darling.
every time I come over here, I see the passion. When you sit before the mic.
Thank
This
you.
is very good, and it's good to see everyone here in the studio. And to those outside, I want to say good morning to everyone and compliments of the season, especially looking at the arrival of our dynamic president coming back home. I want to say uh, compliments to him and members of the legislature, members of the judicial. I want to say compliments to everyone.
Okay. Many thanks, Dr. Kateh. First, let me begin on this note. You've been in one of the counties in rural Liberia. You've been speaking as a commencement speaker. Basically, what have you been talking about?
Thank you so much, Saba. I was in Zwedru, attended the sixth commencement exercises of the Grand Judah Community College, and I was asked to be the speaker. Has been very grateful and humble for such an opportunity, and so it was a difficult decision because there have been multiple things that I was thinking about.
Okay.
But one of the things that I thought about is that when I was graduating from high school, from college, I had a speaker who spoke directly from his heart. And so I decided to speak directly from my heart. And I felt that one topic that many of us have not thought about is trying to answer the question, what is your why? Why did you, Sorbor, decide to be behind the mic? Is it because of money? Did you do a research prior to taking up the mic? Did you understand what the challenges will be? And so, if we do not answer the why, then of course the passion is not there. And when the passion is not there, then of course you don't care about what you do. And I see that, all over nowadays. There are a lot of young people going into different areas of discipline, and because they do not have the passion, it makes it difficult for them. Some of them get demotivated if they don't get what they're supposed to get. But if you have the passion, then of course, whatever you do, you may not consider it as a job. Be- Definitely, it becomes a life for you.
Okay.
So whether you make thousands of dollars or you make 1 cent, that 1 cent can be double. Because when you go to work, you go to do what you love to do.
So, in another word, you are asking the students to begin asking themselves as to why?
Yeah, that they need to basically, even though they are graduating, but they need to do an in-depth search of why they chose a particular discipline.
Okay.
And if they get it wrong, fine. They have the opportunity to do a deep search and come up with something.
But Dr. Kateh, did you outline also to the students as to how they can answer the why?
Definitely. And I talk, before going into an in-depth of that, I decided to talk about my why.
Okay.
Why did I become a doctor? Why do I do what I do as Dr. Kateh? And my why is something that I've said over and over. It was because of my mother, because my mother had one eye. And so, at the age of 12, I decided I wanted to become a doctor. So it doesn't matter whether Dr. Kateh get a DSA or not, he goes around this country. And the more I go out there, the more I enjoy what I do.
So your why is not predicated on what you earn or what you receive.
Absolutely not.
It's just predicated on passion.
Definitely.
So you are asking the students or appealing to them to ensure that our why should also be predicated on passion.
Definitely, because that is the key. And one of the things that I did in my closure, and I can quickly read that here.
Yeah, surely.
And after going through that, so if you look at a job as a job and not a gift, it becomes difficult. Then service is an issue. So I said, one of my best quotes when it comes to service is quoting the late Dr. Martin Luther King.
Mm.
What Dr. King said is that not everybody can be famous, but everybody can be great, because greatness is determined by service.
Okay.
In short, what Luther said is that you don't have to know only about Plato or Aristotle to serve. You don't have to know Einstein's theory of relativity to serve. You don't have to know the second theory of thermodynamics in physics to serve. You only need a heart full of grace, soul generated by love, and love for country
Okay.
to be a good servant.
I think that's a clear way of informing them or educating them on how they can answer the why.
Definitely.
Now, let's go into the health sector, Dr. Kateh. I just thought to start with that because you've been addressing our students and our young people in recent days. And now, where are we now, Dr. Kateh? First, on this whole issue of COVID. Do we still have COVID or has it disappeared?
Definitely, like I always say, as long there is COVID globally, Liberia is never out. We are part of a global community. So this is something that we need to anticipate. But COVID is not as severe as it was. I think we are at the verge as a country to basically concentrate on other areas. Like for now, I'm concentrating more into the curative aspect of our health services. So in terms of our vaccination coverage, it's very, very high. That is very good. We still have a couple of cases, probably every other day or probably within a week, you have 2 or 3 cases and so forth. And I think people are cognizant whenever they have the signs and symptoms and they know what to do. So I think as a country, we have done a great job.
So we are not out of the woods.
No, we are not.
We still got a couple of cases.
We still have.
But do we know how many cases we have now?
I have not found, but I think the last that I got up to Friday, we still had about, I think, 6 active cases within the country.
Severe or
mild? No. They are all mild cases. Most of the cases we are getting are very, very mild.
Why do you attribute that to?
Because, one is the many persons have been exposed to the virus, so they have built some immunity, and so their body has the ability to fight the disease.
But are we still bringing in vaccines, or we've stopped that now?
Oh, definitely. We still have vaccines in the country, and we're still working towards our 90%. So Liberia is doing very well, but I think there are people out there who have not been vaccinated, or there are others that have taken one of their doses, and I think they need to complete. And for those who want a booster, definitely we still have the room for a booster.
Now, Dr. Kateh, I hear often about this booster, especially when COVID was raging very high. What do you call booster?
Booster is just the ability of taking the same vaccine. So, for example, your immunity. So, when you get your first dose, it boosts your immunity. Over a period of time, that immunity decreases. So, what you are doing now is giving another dose that will increase your immunity.
Okay. So as we speak, we still have a couple of cases.
Sure, we still have a couple
of
cases.
Not severe cases.
No severe cases.
So all your wards at the COVID center across the bridge, they are all empty now.
They are empty.
You don't have patients there lying.
No. There is no. If you go to Starbase now, there is no patient there.
Okay. Now, but you spoke about the issue of curative services. What do you mean?
So basically, within the health sector, as Chief Medical Officer and Deputy Minister for Health Services, I have 2 assistant ministers. One on curative, the other on preventive services. So curative services basically takes into consideration the operationalization of all of our clinics around the country, hospitals, and everything. And on the preventive service, this is where you look at various programs like immunization, like HIV, like TB, malaria, and so forth. Those are under the preventive services. Now, most of our partners have helped us a lot when it comes to preventive services. Curative services basically mostly is funded under the allotment from government and from other partners that help with few services, procurement of drugs and other things.
Okay.
And so this is it. But now, this is where we are having our biggest challenge. Challenge in that we've been having problem, and you have reported that with problem with people going to the facility. There are no medication, there are supplies and other things, and so for lack of supplies. And so, going around the country basically has given me additional light on what is transpiring. Now, I did that in consultation with another program that I went along with. So, under the German development to Liberia, and this is being implemented under the WHH, which is the implementing arm of the German programs into a particular country, and they are mostly into infrastructure development.
Okay.
So as you look at curative services, you also have to think about the structure. Do we have the right kind of structure? So even if the medications were to come, are they in the right place? Are the system there to make sure that they are kept well, the equipments and other things? And so the German government has been doing a lot of construction for us, and we are so excited about the various constructions that are going on.
Okay. You listening to the SMS, right? You're listening at 9.9 and also frequencies across Liberia. I'm expressing some feedback. Now, Dr. Kateh, you spoke about whether the right infrastructures are in place or not. Under this administration, how many new hospitals have we constructed?
So, in terms of construction, we have completed the construction of the Riverside District Hospital, which is in Liberia. As a matter of fact, about a month, less than a month ago, we did close to 47 surgeries at that hospital.
Okay.
In a town called Liberia. Now, there's a completion of the talked about hospital in Bapulu, and that hospital will be dedicated as soon as possible. Upon the arrival of His Excellency, the various modalities will be worked out, and the opening of that hospital is imminent.
Okay.
Now, besides the hospital, there are a couple of health centers that are under construction. There are a couple of clinics that are under construction, and looking at the timetable and so forth, I'm sure majority of them will be dedicated before the end of August of next year.
Now, so let's zero in on the hospital in Bapulu, right? Give us a description. How does it look? How many beds there?
The hospital in Bapulu is one of the hospitals that has been constructed, in partnership with the government of Liberia. So the government of Liberia procured the supplies, that's the supplies and also equipment for the hospital with the German government. Now, it's an 80-bed facility. It's also solarized. And in terms of a structure, the Ministry of Health within the infrastructure unit have set up different infrastructure when it comes to how do you build a clinic, a primary level 1, a health center, a hospital district level, and a major hospital. What the design has to be taking into consideration the past experiences we've had in terms of Ebola and COVID, in terms of the triage capacity, and so all of these things are incorporated within the structure. So the hospital in Liberia basically has incorporated all of those things that are necessary to make it a more functional hospital that is capable of withstanding future present situation and future situation. And it also is built in a way that it is built in a modular form. So as the population within Riverside expand, grow, they can also do an expansion on those facilities without changing the architectural design of those buildings.
Now, how are you coping? Because I know there's been an HO problem, Dr. Kateh, where politicians will go into the counties uh, and construct mini clinics and health centers, and at the end of the day, it becomes the burden of the Ministry of Health to man those facilities, to equip them and to staff them. How are you coping with that?
I think one of the good things that have happened is that we have our lawmakers that are working along with us.
Okay.
The Ministry of Health is decentralized. And based on this decentralization, we have a mapping of where we think various level of facilities need to be placed.
Mm.
So if a lawmaker would be interested, one of the things we tell him or her is basically follow the ministry plan.
Okay.
And the reason here is that you don't want to, building is the easiest thing to do. Running it is where it is. So if you cannot run it, if you just construct a building, that building does not become a clinic. It becomes a clinic when it has all of the equipment, it has the requisite manpower, and they can provide services to the people.
Mm.
In the absence of that, it's just another building. And so they have been working along with us, and we are grateful with in terms of that partnership.
Okay. Now, let's talk about the issue of drugs, those essentials in the various hospitals. You've been having some major problem, and often you hear people saying, went to the government-run hospital, and all what you received was just prescriptions. Have you solved that now?
Sorbor, we have said this over and over.
Mm-hmm.
Government alone cannot solve this problem. Running a health center or clinic is not a cheap business.
Okay.
It's very costly. And so it falls within the purview of both the general public working along with the government in order to provide the level of services that they need. And so one of the counties that I always talked about is Lofa County.
Mm-hmm.
I mean, I have seen how many of the communities have been so proactive in making sure that they provide for the clinics. In terms of provision, is basically providing, in some places, medication, a cost recovery scheme. In other places, they will make farm to give to the health workers, cultivate the rice or whatever, and give it to the health workers. That, look, we want you to pay attention to providing care to us. You don't have to worry about food and so forth. We will bring you food. So I think that is their way of contributing to their own success, their own livelihood. They're receiving the kind of quality of care, because if you go the extra mile to provide for those that care about providing you services, definitely you're going to get the best out of them. So the quality of care, matters. And so we see that, and I'm appealing to all Liberians. It doesn't matter where you are, in your community, the various locales, go to the government facility, see what the needs there are, and you look within your own resources. What can you do to make a difference in that particular facility? Because remember, when you get sick, that is not a time to determine what it is. The first level of care is very critical. And if that service is not there, if those things that we don't take into consideration are not there, that could be a difference between you staying 5 seconds or 5 years.
Dr. Kateh, the issue of addressing the shortage or the lack or the inadequacy of drugs in the hospitals, Dr. Kateh, it's multidimensional. Like you said, the people themselves will have to play their own role. But equally so, Dr. Kateh, I'm sure your nurses and doctors who are operating those clinics and hospitals also do have that share as well, because you hear sometimes they say this doctor has his own hospital, or has his own clinic, or his own health depot, and where he takes all the drugs that are supplied the hospital. Are you concerned about that as well?
I'm concerned about it, but this is why my speech clearly indicated
Mm.
that when you look at your profession as a job, then of course the passion is being diluted into the process of providing services. So every one of us I call at a particular time, and it's up to us
Mm.
to do what we can because posterity is going to judge us individually.
Yes, you've answered that partially, but not in totality. What has the Ministry of Health done to your employees, some of your nurses and doctors who are often involved with taking the drugs from the hospital,
They,
reportedly?
yeah, reportedly, and they think here, one of the good thing I love about our country
Mm.
is that when we work in a system and an individual is destroying that system, everyone keeps his or her mouth shut. Nobody wants to say because at the end of the day, no one wants to take a blame. And I often say to people, in the kind of work that we do, we are not ice cream seller. Ice cream seller who want for everyone to love them. So they will play whatever music, they will do whatever it is for the children to come and buy the ice cream. But the kind of job that we do, we are providing services. And so to do that, you have to take some tough decision. And so it falls within the purview of every one of us to begin to hold each other accountable. And if we can do that collectively, then of course we're going to have the kind of system that we all yearn for.
Okay, we'll have the consistent of what yen for. Now let's go into the issue of the drug revolving fund. I can remember, Dr. Kateh, you got on this campaign, traveling to all of the counties in rural Liberia and trying to sell the need and for our people to begin paying small monies for drugs at the government-run hospitals. Have you succeeded now, or are you still struggling with it?
We are still struggling with it in some places, but it takes more than building the mindset. Behavior change is a very difficult thing, and perception also plays a pivotal role in whatever we do. So, for example, if someone say, "Oh, they're getting services free," they may not understand, and like you clearly indicated, that people go to the place and prescriptions are being given to them. Yes, the health workers are there, but sometimes if they do not have that medication, they have to give you a prescription. But if that medication were there and you pay a little, definitely it helps you. Now, you have people on the contrary and say, "Oh, there are a lot of people struggling and so forth." Sorbor, yesterday I traveled from Zwedru into Monrovia. There was no village along the way as I was traveling where they didn't have palm wine shop. I mean, you see people conglomerating, buying palm wine, and the place it was more glaring was in Bunk County. So my question here is that, yes, of course, we know we are all struggling. Things are tough. But the $50 Liberian, the $100 Liberian that individuals are taking every other day or twice a week, if that can be used to contribute towards medication at the clinic, can you imagine what will happen to us? We could transform our own health system. So I think we all need to begin to talk about this.
But so why is it not working? You've been on this for almost 2, 3, 4, 5 years.
The thing here is that when it's one thing talking and it's another thing enacting. So there are procedures, there are policies, there are other things that have to be enacted. And again, there has been some delay. Most of the time, when these things are about to come forth, then of course it's more like, okay, we are going to election. If you want to talk about this, it could have a negative feedback. So all of these things are things that we have to take into consideration. But again, those counties that are doing it, you don't hear them crying about medication. You don't hear them crying about other things and so forth. So again, we are pleading with our people that even if the policy is not driving it, then of course we are feeling the pinch from the bottom. Let us begin from bottom up. So in villages, in towns, in cities, and so forth, work along with your team there and come up with a strategy where you can maintain your facilities so that whatever government sent over goes for a very long time. As a matter of fact, we are doing our distributions now, and we just received, government just procured a couple of $1 million of essential medication. If you go to the central medical store now, you see containers, filled with medication and so forth. So we may have another distribution very soon. But again, when those things go there, after some time, they are all gone. And so how do we all work together to maintain it? By a cost recovery scheme.
You spoke about policy delay. Is it at the level of the legislature, or where is the policy being delayed?
No, it has
in
not,
driving this.
it's been written. It has not been sent over. There are serious discussion, and like I said, most of the discussion now surrounding not based on the policy. The policy is there. The system is being designed.
Mm-hmm.
The problem is that there are orders on the other side said during election year, you cannot introduce this. And so those are the discussions that are ongoing. But we know that while these discussions are being held at various areas, it is important that those that are feeling the pinch begin to do something.
Do you think there's people who are holding the views that you don't induce the or reintroduce the drug revolving fund? Do you think they're trying to undermine the operation and the effectiveness of the health sector?
I won't say that, Sorbor. I think they have their own reasons why they are serving as devil advocate. It is up to us to convince them why we feel that it is more important and it's critical that this is done.
So the reintroduction of the drug revolving fund is still slow. It's still crawling. You haven't yet put that into full swing yet.
No, we haven't put that into a full motion. But we think we are optimistic, and probably at the appropriate time we may come here and say, look, Sorbor, thank LBS and thank other radio stations around that have been helping us to talk about this. And now we are proactively moving forward with this.
Let's talk about, Dr. Kateh, the new health law. The Ministry of Health came up with a very new law, and part of our provision in that law, part of it has to do with the issue of abortion, women getting rid of their fetus and all of that, and that became a controversial issue. So is it on that note that today we see a slow pace of the drug being passed into law? Or what?
I don't think that is the process. I think the point here is that, and I think I said this here again, in that law, the law is not banning. We are not. What we are trying to do within the law is basically giving people the choice to live. And when it is done, if someone is being raped, and there is a fetus that may have an issue, it is good to go to a safe environment where it is done and the life of that mother can be saved. And so
that's encouraging abortion.
So it's not the fight of abortion. It is the fight of saving the life of someone who has the ability to continue to provide for this country.
But Doc, it's a bit complicated if you look at that, because those in the religious cycle will think that you are trying to encourage or countenance people conducting sort of that sort of crime, and are trying to discourage them.
I don't think so. So one of the things I will tell those on the other side is that please go and read the current law, the 1976 law. The 1976 law gives individual. So a woman has the right to go into the bushes and put insert stick in herself and abort, do self-abortion. And what we are doing, those at risk, we are seeing.
You try to modernize the abortion.
We are
now.
seeing life being
You
lost.
try to refine the
So
abortion.
what we are trying to do is to save lives, because so many young women have died based on the law that we have crafted, the law under which we have operated. And what we are doing now, looking at what it is now, how can we begin to save the life of our young people?
Dr. Kateh, let me get you answer this question this way. Are you trying to modernize abortion, or are you trying to discourage it?
It's not modernizing it. It's not discouraging it. What we are doing is provision of a safe care.
You're listening to the SMS rated on the OBC 99.9 and other frequencies across Liberia. Our studio guest is Dr. Francis Kateh. Dr. Kateh is the Deputy Health Minister, and also he's Liberia's Chief Medical Officer at the Ministry of Health. Now, Dr. Kateh, let's talk a bit about capacity building. How many of your nurses and doctors now you have away?
I mean, it's difficult to come up with the numbers, but I think as a country, the country has invested so much into doctors in different areas. Very soon, we'll have our own specialists in ear, nose, and throat. We already have some of the doctors back into the country. We have urologists Liberian urologists back into the country. You also have a cardiothoracic surgeon who has completed his the first portion of his studies and so forth. So I think very soon Liberia will get to a place where we are bombarded with the different specialties and subspecialties in the field of medicine.
What is the arrangement on which you send these people out?
So there are a couple of, under a couple of streams. So for example, there are individuals based on their own passion who go out there and go into a particular area. There are others
on self-sponsorship.
On self-sponsorship.
Okay.
There are others that they based on what they have done and what they need is that the government have sent them over. And there are others whom are through relatives or through other funding mechanism have gone out there. But all in all, my deputy, when it comes to the doctors and the nurses, under the doctors, my deputy, Dr. Gobi Logan, basically follow up on these people, and as they come back, we have places based on where we have the equipped facilities to take care of those people. We try to assign them.
How do you cater for them when they are out?
I mean, so one of the things that we do is that from the ministry, prior to leaving, they go to the planning unit where they sign a bond. And so what happens is that under that bond, they still receive their salaries.
While they are there?
While they are there.
Okay.
And so that is a government way of telling them, look, even though in other places we are paying your tuition, but at the same time, you have to take care of your family, and so we continue to give your salary.
Okay, now, Dr. Kateh, I know it can be somehow strenuous, especially where you have a lot of people out, who have gone for studies and all of that, and the ministry of the ministry is catering for them. But is that part of? Is it included in your budget that look, this is allocated for you to build the capacity of your people, or how do you get the resources?
So the resources come forth in one or two ways. For example, under the Pillar 1, the government have decided to give power back to the people. In that process, they've decided to work along with the ministry and see where capacity needs to be built. They have sent people in those areas. Now, under that is through that mechanism. So you have a continuous discussion between CSA, Ministry of Finance, and the Ministry of Health. And all of these things played a pivotal role in terms of how we build the future capacity of our country. So, for example, now we'll soon be having a couple of anesthesiologists coming back, and anesthesiologists are very critical. When you are doing surgery, you need the surgeon to concentrate on the patient, but the anesthesiologist makes sure that our patient survives, during the process. And so, all of these specialists coming back to the country. But another good thing that have happened in this country is we training our own specialists. So now we are putting out a lot of specialists, in OB-GYN, pediatrics, surgery, internal medicine, ophthalmology. Now we just put out our first, psychiatry. So I think we are getting there as a country.
Okay, building, the specialized professionals.
Definitely.
Now,
So within and without.
okay, that's good. Dr. Kateh, who are the partners currently are you working with now in the health sector?
We have multiples of partners.
Okay.
But let me just give you very few of those, of the many partners we have. So for example, USAID has been one of our great partner. We have, when we talk about partner, I don't look at WHO as our partner. WHO is our technical arm.
Okay.
So they will always be there to help us, to guide us, and make sure that we are working within the global scheme when it comes to provision of healthcare system. So we have World Bank is working with us. We also have within country, you have UNICEF, you have UNFPA. These are all working. JAPIGO, all of them are working along with us. You have Last Mile Health, you have PRH. So we have multitude of partners that we work with, and most of them concentrate in a particular area within the provision of healthcare services.
Are they not duplicating their functions?
No, we are monitoring them. So in terms of duplication, yes, you may have it. Whenever we have that, we correct that. Like now, we are looking at, as we move towards the performance-based financing, we are working along on the FARA arrangement that is within the Ministry of Health that is being supported by USAID. We are looking at that and what World Bank going to do so that we cannot have duplications and so forth. So yes, in the past there were multitudes of duplications, but as we decentralize and work along with the partners and do good partners mapping, definitely we unearth these things and make those corrective actions.
Let's look at the capacity of our health sector, Dr. Kateh. Draw in the issue of logistics as well, equipment in the various hospitals. What's the story?
I think the story is changing. Sorbor Judge, I'm not so much of a person who will be so boastful. But I think if you look at when this new hospital is dedicated in Bapolo, you will see a different dynamics of healthcare service in this country. When Jackson F. Doe Hospital was open, we saw what happened and what that has done to the scheme of healthcare system in this country. That developed a competitive process in terms of provision of quality care. And so with the coming of the Emirates Hospital in Bopolo, definitely we are going to see a different level when it comes to provision of care in this country.
Finally, before I open the lines, Dr. Kateh, you are the Chief Medical Officer of the Republic of Liberia. You are the engine of the sector. The entire sector operates basically under your watchful eyes. And the sector includes the hospitals, the manpower, the nurses, the doctors. How are you coping or addressing these incessant and these constant complaints about misconduct regarding some of your nurses and doctors, especially people going to the hospital and instead of a nurse or a doctor giving a person attention on the cell phone or doing something else, this sort of misconduct, and not in fact also talking with the patient properly and humanly. How are you addressing this?
So Sorbor is, the thing here is that we cannot police every facility in the country. But what we try to do is basically when these issues come before us, we desire, go ahead and provide the necessary, you know, training. You see, sometimes
You don't penalize people. You treat them.
I mean, the point here is that you have to realize, and this is something that we need to understand. Liberia has gone through so much as a country. For those of us that experienced part of the war, whenever you try to penalize someone, they put up a defensive posture. And so, whatever you do, it doesn't move them. So what you do now is that use every incident as a learning tool.
So in another word, you try to avoid or losing the genesis or losing the people living. No,
We are not talking
exodus of the people living.
No, not really. What we are trying to do is that we have a different mindset of individuals. And so how do you change that? And this is where servant leadership comes in. Servant leadership is not the ability to penalize. It is the ability to change. You putting yourself into the situation, this person, understanding that you as a leader knows exactly what has to be done and how you do it.
Don't you think that encouraging more misconduct on health workers at the hospitals? Is it not you trying to do now?
It is not the process of
Because you don't penalize them. Instead, you say you got to treat them to come up with a good attitude and behavior.
Sober Judge, if we continue to penalize people, we penalize almost every entity in this country. If you go to the bank,
you try to justify why doctors and nurses sometimes misbehave.
I'm not justifying, but I think it is way beyond penalizing because we have done it and it's not changing.
Okay, let's take this pause quickly. Let's take this
pause.
pause. When we come back, we'll open the lines so that you can interact with Dr. Francis Kateh. Okay, the man Michael is here already. Michael, good morning.
Argentina are the new World Cup football champions. They defeated the defending champion of the competition, France, 4 goals to 2 on penalties on Sunday. Regular time ended 3 apiece. Lionel Messi of Argentina was named the Golden Ball winner, while Kylian Mbappe of France won the Golden Boot, scoring 8 goals in the entire competition. Meanwhile, Messi has said the final will be his last for Argentina. Let's wait and see how it pans out in the coming months. France came second, Croatia third, and Morocco fourth. The next edition of the World Cup is scheduled for 2026, and the 2022-2023 National County Sports Meet kicked off at the weekend in the port city of Buchanan. Here are some cracking results. In football, Bomi County 2, Reboji 0, Lofa 2, Nimba 1, Bapolu 2, Sino 0, Grangire 2, Cape Mount 2, Maryland 0, Green Crew 0. In kickball, it was Lofa 1 inning, Nimba 1 inning, and Bombing 2 innings against Reboji with 1 inning. Sober, that's it.
Many thanks, Michael. We really appreciate your time this morning. We now open the lines quickly. 0776-540-987 or better still 0880-514-096. Our first guest here is Dr. Francis Kateh. Dr. Kateh is the Chief Medical Officer of the Republic of Liberia. He's also the Deputy Health Minister. Good morning.
Good morning, sir.
Good morning, sir.
Okay, this is the Chief Medical Officer of Liberia. And I'm speaking from Boya District Division in the faculty. But let me just say hi to Mr. Minister for the exposé this morning. So let's way past of all with them following them. For instance, sometimes of us, you go and they do argue some questions, and we don't get anything here. What is Sector Mr. Kateh doing to warn that so that citizens can have their peaceful message? Thank you.
Okay, Dr. Kateh is taking notes. Good morning.
Good morning. How are you, Sorbor?
I'm okay, sir.
This is Joe Wellington Water Sorbor. I'm a young activist. And I want to say thanks to the Republic for the hard work in health system as they improved the Ebola. And now we are seeing the decrease in the to post-coronavirus. But now I want to stress on the issue of monitoring, the issue of management of health equipment and available logistics. I have a great issue when it comes to private health facilities, Dr. Kateh. Most of the service delivery and the dispensing of medication is not outlined as per the pricing. And sometimes the cost of emergency is so high. So I would like to know what you have to put in place to what the government and the health system have put in place in terms of managing government assets, in terms of available logistics that we see the cars that are being misused, and we are seeing that the issue of timely dispensing and the high cost at private health facilities. Thank you.
Many thanks. Let's take this call on the line. Good morning. Okay, that caller is gone. Let's take this other call on this line. Good morning.
Good morning, Sorbor. How are you?
I'm okay, sir.
Yeah, this is Ishmael IT James friend calling me running for Indiana, calling you from Wheeler County, Liberia.
Let's hear from you.
Let me appreciate the minister in the studio this morning for his nice presentation. Mr. Minister, Honorable Minister, thank you so much. What you have been saying is, what he said over there, I'm really happy. With not only the pay, but when you got the passion of the job, you can do it to your expectations. So I believe, Mr. Minister, you continue doing what you are doing. Keep on what you are doing. May God bless you.
Many thanks. Let's take this call on the line. Good morning.
Good morning.
Yes, good morning, sir.
Yeah, good morning.
Let's hear from you.
Hello.
Good morning. Let's hear from you.
Jana, this is Prince Jana calling from Dubo Road.
Mm-hmm.
Dr. Kateh, my concern has to do with the hospital in Babolu County. But concerning the volunteers, you say you will be dedicating a new Embry hospital. Why will the volunteers still go back to go to the new hospital as volunteers, or will they be on common payroll, or will there be incentive given to them as they move up there?
Okay, many thanks. Dr. Kateh is taking notes to respond. Good morning.
Yeah, good morning, Mr. George.
Yes, sir.
Thank you very much. I appreciate calling. It's Anthony Isukute. I'm from a protocol in Yucatan. My concern has to do with vaccines in the Republic of Liberia. Our information is saying that no vaccine in Liberia. And so, as a result of that, the other day my grandson was born at Kateh Hospital. Up to now, the simple BCG vaccine has not been given. So please, our able doctor, medical doctor, chief medical doctor, please let him address that, the issue of vaccine in Liberia.
Okay. You address that. Good morning.
Thank you.
Morning.
Yes, good morning.
Yeah, man. You talk about it. I want to say thank you to that. But we talk about boosters. Who are eligible for the booster, and how does one acquire the booster?
Okay, Dr. Kateh will respond to that. Good morning. Good morning. Hello? Okay, it seems this caller is not ready. Let me take this call up quickly. Good morning. Good morning.
Good morning, Sorbor.
Yes, sir.
My name is Rufus Yami. I'm calling from Tapeta.
Okay.
And I appreciate that Kateh so much being in the studio, because when it comes to Tapeta, he's our chief. I say compliments to him. My concern has to do with the last question you posed to him, where the nurses, doctors, kind of sometimes very insensitive, to the plight situation of the health situation of nurses. Patients at the hospital.
Mm-hmm.
He didn't really, answer the question, to our taste. And the second thing is, most of the private school, private hospitals, the private health institutions are charging so much now because they see the deficiency in the public sector. What the ministry is really doing to put check on that, because you can't be operating hospitals, and especially most of the hospitals are Christianly owned hospitals.
Okay.
You can't be charging so much, in a poor country like Liberia, where most of the people are unemployed. Thank you.
Okay, let me take the last caller and then go back to my studio guests. Good morning.
Good morning.
Yes, good morning. Good morning.
Yeah, morning.
Yes. Okay, let's hear from you.
Yeah, good morning, Sorbor. How are you doing?
I'm okay. You are on. Go right ahead.
Yeah.
Okay. It seems we can continue with this caller. Let's go back to our studio guest to respond to those concerns, and we'll wrap up with him. Dr. Kateh.
Thank you so much. Again, let me say a big thank you to all of the callers, and I really appreciate that you were listening and able to ask these good questions. So let me start with the last caller in terms of insensitive to patient and so forth, and then the escalating costs from private practice. So insensitivity to the needs of patients, like I said, is based on leadership. So at every institution, like I said, we do not police every entity, but it is important that the leader of an institution should have within his administrative skills to deal with this issue. The way it is done, the way that leadership works, the better it is. And my brother that called from Tapeta, he saw how Dr. Kateh ran Tapeta Hospital. At Tapeta Hospital, we suspended nurses, we suspended doctors when it came to certain actions and so forth. So those things fall within the purview of the leadership and how the leadership work with the people. Now, in terms of the escalation when it comes to cost at private entity, remember, the Ministry of Health does not have the legal bargain to set this. Now, with the decentralization, with the delineation of responsibilities, that aspect in terms of monitoring, supervision of facilities around the country, even the government facility, falls under the purview of the Liberian Medical and Dental Council. Okay. So based on the act creating that, there where it is. Now, in terms of the booster, definitely the booster is that after you should have taken a vaccine, basically 6 months later, you can go to any of the places you took the vaccine and you can get a booster. So it is not a difficult thing. Now, again, a caller call with in terms of what we call the routine vaccine, the BCG and others. Again, let me say that the ministry is working tirelessly in making sure that working along with her partner, UNICEF, to bring in all of the necessary vaccine ASAP. Remember, we had so much in the country, but because of COVID and other things, there were many of them that could not be used and so forth. So in terms of the provision and those companies that manufacture these things, basically there were a lot of backlog. So again, I want to apologize to the general public, and we are doing everything, working with UNICEF, where emergency vaccine will be coming in very shortly, and also through the World Bank, we'll have more vaccine coming in, and also from the government of Liberia, more vaccine will be coming in. In terms of the hospital in Bapolu and so forth, as a matter of fact, the HR director at the ministry and myself going to Bapolu City to look at the HR issue. There are a lot of issues surrounding it, volunteers. And volunteers, we've talked about it here. There are people that are on government salaries that's supposed to be at the hospital in Bapolu, and they are somewhere else. But again, when we get there, we will talk about it and we'll have it fixed. Again, I want to say thank you for the appreciation from my brother and friend all the way in Lofa. In terms of monitoring, management, and so forth, it relates to the same thing. So the monitoring of health facilities around the country falls under the purview of the Liberian Medical and Dental Council. So in terms of medication and so forth, like I indicated, our distribution is ongoing now, and very shortly, our brother in Lofa and other parts of Liberia will definitely see enough medication at their various facilities.
Dr. Kateh, before we take leave of you, what's your parting comment to your health workers?
Again, I just want to say a big thank you to all of the foot soldiers. We know what the challenges have been. We know what the pain you have taken individually. But again, like I often said, the craziest job that anyone can think about doing is being a healthcare provider. Because what we've done is that we've decided to do things that other people won't do, play with pee, blood, and so forth. But this is what makes us special. And so let us begin to hold on to that passion that makes us special. One day it will be fine for everyone. We are optimistic that it's going to get better. We are seeing some gradual changes within the health sector, and definitely we are going to get it. But please be patient, and I want to wish you all a Merry Christmas and a prosperous New Year. Thank you.
Well, he's Dr. Francis Kateh. Dr. Kateh is the Chief Medical Officer of the Republic of Liberia. He's also Deputy Minister at the Ministry of Health. Dr. Kateh, thank you for taking time off your busy schedule to appear on the SMS this morning.
Thank you so much, Sorbor. I want to say thank you to Estelle Liberty and all of the staff of this great radio station. Every time I come over here, I'm just amazed with what I'm seeing. Thank you.
Thank you for the compliment, Doctor. And so I'm sure very shortly we'll have